we don't want to go really fast. We want to stay at a slow pace.
Yeah. Well, probably if you pulled it fast, maybe it would hurt. Is that it?
No, but it just would damage,
Oh, okay.
you know, and we don't want to damage any of the
Slow's
cells.
better.
Mm-hmm.
The sauce is there, you said?
The slow's better. Any of the cells.
Yeah. Oh, the cells. I
No,
think
the
so
sauce is what you had.
And this is the worst part, is the numbing. After the numbing, you really shouldn't feel much.
You don't feel anything other than...
What are you feeling now when
You
we're
know
in jail?
what? Like sticks, like, you know, prick sticks, but not, it's not crazy painful or anything. I think this is the 8th time like having this done. The first time, since I wasn't, you know, I didn't know what to expect, I think it was a lot worse. And then I was, of course, worried about the fact that she was rubbing the hair out of my head.
Right, and she's just kind of stimulating the
Right.
scalp, and it's really important because everybody's afraid, you know, when you're losing your hair or if you're having shedding, you're afraid that you're traumatizing the scalp, and we're really not. We're just kind of stimulating, and it's and a lot of the shedding is not permanent, although it's really hard to explain that to patients sometimes. But we already have the block done. Do you feel it getting numb yet, or not yet?
Not yet.
Not yet.
No.
Okay. Well, we'll wait a little bit.
Okay.
So even if we treat the whole top, and you know, we do treat this area in the frontal temporal angle here because she had some thinning, and we've done over 4,000 procedures and really not had any side effects other than you can get a little bit of swelling.
On the forehead, yeah.
On the forehead,
Yeah.
and it's just a gravity thing, so we usually recommend that you sleep on your back for a couple of days and maybe ice your forehead, but it's not a reaction to anything, it's just a physical.
And how many women, as opposed to women, do you think it's more women that come in, or do you think it's...
I would say that with non-surgery patients for injections, 60% of our patients are females, and surgery patients 40%. So the large majority of patients for the non-surgical treatment, because females really don't have that many options to maintain existing hair, and this is a safe, viable option. So does it feel like it's getting numb yet?
You know,
How
I'll
about
know
if-
when you start rolling on me.
Okay, well, we use a 1 millimeter roll, and what we're trying to do is just stimulate the scalp so that we cause a slight wound on the scalp, and by doing that, what we're doing is sending a signal to the follicular stem cell to send cells to heal the wound, but it also sends a signal to the follicle to go into an early growth phase. So hair can't improve regardless of what protocol it is until the hair goes into the resting phase and comes out of the resting phase into the growing phase. So we're just trying to stimulate the scalp and turn on the follicular stem cells to go into
that part wasn't numb.
That part wasn't numb enough? All right. And yeah, this is the PRP. And we'll start in a pattern in the back. And
Now, this is good in keeping the hair in more of an anagen phase for longer, or
what we want to do is we do a number of things. You know, with hair loss, we have inflammation, and with male and female pattern, inflammation becoming more and more important. So PRP and the growth factors are powerful anti-inflammatories. The next thing, there's numerous studies that show that one of the growth factors, like vascular endothelial growth factor, is a growth factor that produces new blood circulation. And when you produce new blood circulation to the follicle, there are numerous studies that show that the follicle will get thicker and bigger. And so that's one thing. One of the other growth factors, platelet-derived growth factor, is very important to regenerate fat and fat cells. And there was a great study done out of Yale last year that showed that PDGF, or platelet-derived growth factor, is extremely important with regeneration of fat, where a lot of the vascular stronal stem cells are in the fat layer below the surface of the follicle. So if you see a patient, a male especially, that's completely bald, the more hair loss you have, the thinner the scalp gets. So we like to regenerate each layer of the scalp and turn on each layer of the scalp. Okay, how's that?
And it's fine. I mean,
You're okay?
It's fine. I mean, it's definitely burning, but it's.
And so we always go from posterior to anterior and covering the entire area. And we're done with the PRP.
Okay.
How you feeling?
What?
Just give me one of the small. How you feeling?
Well, it stings, you know. It does sting.
And now what we'd like to do is just massage it in.
I have experienced this before. I think because you use a bigger needle, maybe it was more of a thing.
More of a sting,
Although
yeah.
the first time that you did do this, that was a bit of a shock. This is the 8th time, so it's not as scary. But you know what to expect. It's not as bad.
We did use a little larger needle because your protein matrix was so thick, which is great because we like to use the protein matrix that entraps the growth factors, and it's made of your pure protein, which is what your hair is made of.
Yeah.
So, the thicker it is, the longer the growth factors stay in the treatment area. So it gives almost a sustained release. And
it's up to you if you want to talk about it, but you choose not to do the A-cell thing. Do you want to mention why you don't?
I like to use the natural protein matrix because it's made from your protein, which is what your hair is made of.
Right.
And I feel that there are regenerative qualities in the adhesion molecules of the protein that is yours that is synergistic for hair.
Yeah.
More so than A-cell. I think A-cell is good with bleeding tissue, but non-surgically I prefer to use a natural protein matrix because of the content of the protein and what I see it does with hair.
The stinging is subsiding, just so you know. It's definitely coming down.
Yeah, and the stinging will usually last for about 3 to 5 minutes, and then after that activation, we usually tell patients take some Tylenol, you may get a little scalp soreness.
You said it's important not to take Advil, right? You said
yeah, because the anti-inflammatories have a tendency to
reduce the
efficacy of the platelets.
So it's really important to only take the Tylenol.
Exactly, that you take Tylenol. No harm in utilizing your own cells because you're not going to get any reaction from your own cells.
And I think I asked you this earlier, but I don't think I asked you on the camera, what percentage of the women that you see coming here are experiencing appreciable benefit, whether it's in regrowth or just in helping to reduce the shedding?
I would say about 75% of the patients that we treat come back for follow-up treatment. I mean, no therapy, no protocol is 100%.
No, it's going to work for some, it's going to work for others, and I think to varying degrees.
And it depends on patients' expectations. So we really try to find out what realistic expectations patients have, and so our goal is to maintain what you have and hopefully improve it. We feel that not only are we thickening existing hair, but we are also bringing out some new hairs that are going into that final resting phase. And the most important thing is it's a safe therapy. It can be used with FDA-approved therapies, and it can be used if patients have failed other therapies, and it's just a great procedure.
I think a lot of people worry also because if you start a treatment like Rogaine or Aldactyl, there's that possibility that any hair loss treatment can trigger a shed. So do you find that, I mean, I haven't experienced that personally, but do you find that anybody that's actually done this has gone through a shed from the treatment?
Yeah, that's a great question. And I would say the majority of patients do not shed. Actually, the shedding decreases, but the small percentage, maybe 10%, will go into a dread shed that everybody worries about because, again, any protocol, whether it's hair transplantation, whether it's finasteride or Rogaine, hair must go into the resting phase before it can improve. And so,
worse before better. But not for everybody.
Not for everybody.
I personally haven't had a shed from it.
Right.
A treatment. I mean,
it is atypical with this treatment to go through a shed. It actually, more people experience less shedding within the first month. I would say 90% of people experience less shedding, but everybody's different.
Everybody's different. There's
Everybody's
no
different.
magic thing for everybody.
Exactly. One thing I would like to mention, in 5 years that we've been doing this, 6 years that we've been doing it, patients that we've treated for those 5 years that are maybe on a once-a-year maintenance now, I've had ladies in their 70s that were wearing hair systems that don't have to wear their hair systems anymore. They feel good enough that they didn't have to wear it. So it seems like, yes, it improves for a certain time, but as we retreat, the curve goes up, because we're regenerating each layer of the scalp.
And what's the recommended time between treatments?
Initially, especially if someone's shedding, if they have problems, I like to do it at least by 6 months. And then we can maybe extend it out to 8 months, but I'd say that 6 to 8 month period is the best.
6 to 8 months.
Yeah.
Since I'm doing this to get off of
now that's with female and male pattern. If it's alopecia areata, we like to treat once a month for about 3 months and watch and see how the hair grows, and then every 3 months for the next 2 months, and then that's...
But for me, since I'm doing this to get off my birth control pill and kind of stave off the shedding, you think every 4 months will probably be a better approach?
I would think 4 months would be good till you see...
Till past the year mark.
Until you pass that year, and then you can go twice a year.
Okay.
But
well, I'm optimistic.
How do you feel right now?
Now the stinging stopped.
The stinging stopped.
Now it's just the swelling, which is normal. That's normal.
Yeah. So we would recommend that you'd sleep with your head above your heart and ice your forehead. And other than that, you know, if you've got any down swelling, generally comes on 2 days, lasts a day or so, and then goes away. But it's not a reaction. It's just a physical, it's just gravity.
So well, I'm not worried about that.
You did good.